Finally, clinical trials. Well, there are people that I know, I'm not going to name names, who think that we've tackled the melanoma story, we've solved the puzzle, we don't have to worry about clinical trials, the answers are in. I think that's absurd, and you merely need to tell the patient who's in the ER right now, who's a patient of mine who's got progressive melanoma and is probably going to die of disease. The answers to melanoma are not all in. The story has not been definitively addressed. We have not cured all melanoma. 50% of all melanoma patients, at least, who have metastatic disease will go on to die of their disease. That is not a trivial number. And while effective surgical technology, effective adjuvant therapy given after surgery, or neoadjuvant therapy before surgery will reduce the number of patients who develop metastatic disease, there's still plenty of patients who will die of melanoma in this country and everywhere in the world. And that's why we need to be able to put as many patients as we can on clinical trials. Every time I see a patient, my first thought is, are they appropriate for a clinical trial? Many of them are not. But there's almost never a scenario where there's no reason to even think of a clinical trial in melanoma. In anyone who has stage 2B, 2C, 3, 4 melanoma, which is the majority of the patients we see as medical oncologists, you should not think that we've done so well that we've licked the problem. We ain't licked the problem, trust me. We need to continue to do clinical trials. We need to especially do trials to reduce toxicity. I have a trial where we take combination immunotherapy and add a third drug to try to reduce toxicity and potentially increase the effectiveness. Those are the kinds of trials that need to go on. We still have plenty of room to go, and I hope to have at least 10 good more years left in me. I hope that we can lick this problem in the next 10 years, but it's going to take everybody's energy and effort, and we're going to need to put thousands and thousands of patients on clinical trials going forward to finally put to rest the idea that somebody might die of melanoma, this deadly disease.